Coming up on today's show, we have your COVID-19 updates and how it's affecting your mental health. Hello, darlings, and welcome to your weekly COVID-19 update. I am your host, Portia Scott, and I am joined today with not one, but two co-hosts, Dr. Donovan Christie and Marty Sellers. So before we get into the show, I want to know, where are you guys watching from, darling? How are you doing? Where are you staying at home at? We want to make sure that you are social distancing. We are trying to make sure that we flatten that curve and that we are all healthy and that we don't overload our healthcare system. And so we can go back to living life not as normal, because I almost don't want to go back to normal. I want to go back to a place where we're caring for one another the same way we've been doing over the course of these couple of weeks, over the course of a couple of months. And so with that, I want to know, where are you watching from? Where are you guys tuning in? Thank you so much for joining. So one of the things we love to do around here is acts of kindness. Usually what we do is we partner with another organization, but I am challenging us to make sure that we are doing acts of kindness for our neighbor. Listen, I love to say, you may not be able to feed the 5,000 or do for 5,000, but guess what you can do? You can do for the one. What does that mean? That means you can pick up your phone, send a text, send an email, call someone, send a cash app. We all know someone that needs and can use a random act of kindness at this time. So that's our challenge to you. One of the other things is we want you to stay in the know. We want to stay in communication with you. The way that we do that is by text. And so if you text the phrase "wake up" to 31996, that's "wake up" to 31996. You'll know when a show is going live, when we drop a new Wake Up and Show Up podcast episode. Also, a little inspiration and empowerment for your day. So listen, without further ado, I want to bring in my co-host for today. My first co-host is Dr. Donovan Christie. Doc, how are you today?
I am well. Got my exercise on and I'm ready for the show.
I saw that. You guys did like 10 miles today, right?
No, 10 miles. No, we did. Yesterday we did 23 miles on the Silver Trail. Yeah, it's fun.
Wow. We have someone from South Africa. Yeah. Hello, darling. Thank you so much for joining all the way from South Africa. Okay, sorry, 10 miles. I insulted you. 23 miles. I mean, good night.
Jackie and I did it. That's her first time out this year. Obviously, a lot of people, the parks were closed, so
yeah,
they finally opened up. But there wasn't that many people, so there was the proper social distance, and it was just good to get some sunlight and fresh air and just move with the wind.
Absolutely, I love it. So I'm going to introduce our second co-host for the evening, Mr. Marty Sellers.
Hey there.
Hey, Marty. How are you?
I'm well. How are you both?
We're doing good.
Awesome.
Excellent.
So you guys know how I love to do around here. I'm going to put you on the spot. Marty, I'll let you go first since you're the newcomer.
Okay.
What are you grateful for? What are you grateful for today?
You know, I'm really grateful for, in the midst of everything, still having my family next to us, being close, that we've been safe. We are growing closer as a family. So I'm just grateful for that, and just that we're actually having fun and learning and rediscovering family values. So that's what I'm grateful for.
I love that. Doc, what about you?
Well, this week, I just want to let you know that I'm grateful for my staff. I have about 22 or so employees that work in 2 clinics, well, 3 clinics if you count my concierge practice. And, they've come in, they've worked hard, they've done everything that they need to do for the people.
Yeah.
They're wearing proper protective equipment, and you don't see the fear, and that's
Right.
what I like. But they recognize their obligations and their commitment to helping people, and
I
I'm very
love it.
grateful.
I
Mhm.
love it. I love it. You guys know, it's so funny. This is so small, but I'm loving it. So we bought a fire pit and some hammocks last week because my husband took a week off just to go downstairs. That was his vacation. And we bought these. And, my kids love the s'mores. They love sitting out in the hammocks. Literally, my son has been in that hammock for like 3 hours. Like he could just sit out there. And I think I'm just grateful for the little things, right? So that
Mhm.
just, we weren't on a plane going anywhere, flying anywhere, but we were at home and I could just see the fun, the excitement, the twinkle in their eyes for the little things. So I'm so grateful for the little things. So I want to know, you guys out there, what are you grateful for? Type it in the comments. You guys know what we do. Hello, Atlanta in the house. Hello, Magdalene Darling. One of the things that I do on my daily show, and so you guys, I want to do here is that when we are saying something, when we're asking a question, when they're answering a question, I want you to type in, hello, darling, because that'll let us know that what we're saying is resonate with you, is questions that you have. Listen, listen, listen. We also want to make sure, send your questions in now. We have our own questions, our updates that we're going to bring to you, but we want to hear your questions. You are the reason why we are here, because we want to make sure that we answer those questions that you've had. I said on the post, you've got questions. Guess what? We've got answers. So we're going to jump right in to the meat of today's show. Doc, let's talk about it. Let's
All
talk
right.
about what's going on. So Georgia has
Mhm.
opened up, right? Or partially opened, or whatever you want to call it. And let's talk a little bit about the latest statistics just in cases and death in the world. Kind of the US and Georgia. And I think this is
Sure.
important to hear this. We always tell you guys don't watch everything, but I think understanding that and understanding the precautions that we need to take as well. So, Doc, I'll let you
Sure.
go for it.
Yeah. So, looking at this pandemic, you want to look at the world first, and then we'll narrow it down to the US and then Georgia. In the world, there's almost 3 million cases. It's 2.95 as of this morning, with over 205,000 people that have died from COVID-19. This is worldwide. Now, in the United States, we have almost a million cases, 982,000, with
Wow.
over 55,000 people that's perished. 55,000 people who were alive, say 2-3 months ago, that are now that's now gone. Obviously, lots of those people were people in nursing homes or long-term care facilities, and people who are elderly. So, there was definitely certain high-risk people with chronic comorbidities that have passed. But in Georgia, when you look at Georgia, we have 22,695 cases. So in this state, we have almost 23,000 people diagnosed. And out of that, we have about 900 people that died from COVID-19 in Georgia. Now, the next question is, are we ready to
Right.
open up? And I'll let you get to that when we get there on the show.
So honestly, that's a great segue into the next question is,
Mhm.
I think Georgia, South Carolina, and Oklahoma, I believe, like Alaska, but we're not really,
Mhm.
but
Mhm.
anyway, those are the states that have opened up or partially opened. And some of the things that they've opened, I think, is the concern is that they're opening beauty shops and barber shops and nail salons and gyms, places where, and maybe I'm wrong, but I know when I go to my hair salon, I mean, she's all on my head. Like there's no social distancing. And so maybe it's, keep one person in. And so I think that some of the concern is what's being opened up.
And the sad thing is that, there's a few $100 billion that's been allocated for quote unquote small businesses. with employees, right? So
Okay.
if you're a barber, you're working for yourself, right? Most of the people working in salons, or they rent a chair, or they may be an employee, but nonetheless, you would think that if these are personalized personal services that we need that much, especially in the minority community,
Right.
that those people would be able to get the money. But
Right.
when, as I could tell you that when you look at the people who have gotten this money, I mean, most of them are banks, small banks that they need money. And then the bigger corporations like the airline industry, they're getting a ton of money. But it's the money that's not going to the people, because these people, they don't have the money to do to eat. You know what I'm
Right.
saying? So it's like
You're right.
they're on the fence. Should I go and work because I gotta pay my bills, right? And
Yeah.
so
Yeah.
we need to go, if instead of opening them up, so just give them money that's going to last for 6 weeks, right? I mean,
Absolutely.
wouldn't that be better? But that's not what they're doing. And then they put you through all these hoops, and then you think you're going to get the money, and you don't get the money, and then there's one more this, one more that. It's really ridiculous the way they're dispersing funds for that payroll
Yeah.
protection program.
Yeah. And
Yeah.
I think it's hard. And I guess one of the questions is for us to partially open even that, do we even have enough testing to identify, it's kind of a double question, to identify those people who have the virus or those people that have antibodies. But when we look at kind of,
Well, yeah, it's a very good question, but let me explain what's going on. So in Georgia,
yeah.
they have the Institute of Health and Metrics and Evaluation. This is situated at the University of Washington,
Mhm.
and they predict, based on the number of cases that are coming out of each state, when that state open. Okay?
Okay.
They recommend that the state of Georgia should open on June 22nd. That's about 3.5, almost 4 weeks from now.
Yeah.
So it is premature that they've opened up. And the businesses, these personalized services where people are certainly on top of you, and it's going to be very difficult to do social distance. But how they base that, how a county or city should open up, you have to do testing. You have to do aggressive testing. You have to do what they call contact tracing. So if anyone has had the disease, who were they? Did they possibly find those people, test those people? Then you have to do isolation, and then you still have to limit the crowd size to no more than, say, 10 people.
Right.
That's not all happening. All you're saying is that, okay, you guys are open up now on Friday, and there's no testing. Because if I was going to do that, I would tell people, okay, I'm a barber. I want to know, right? Do I have the antibodies? Have I been exposed before
Right.
I go breathing down on people, cutting their hair or doing their hair? So that the person who is doing the duty should be tested. The clients that are coming in, they be tested. If not tested, at least they should complete a questionnaire regarding symptoms. Their temperature should be checked, and
Wow.
obviously you should limit it. And it's a quick zap. You can check somebody. That's what they do when we go in the hospital. They check everybody's temperature because you
Right.
can go in there. So if you're sick, if you're having fever, you shouldn't go anywhere. You should stay home, right? So, I mean, that's one of the things that could be done to minimize the transmission. But is that happening? No real guidelines were given. They're just saying, okay, well, you're open, fend for yourself.
Right, right. Doc, you bring up some really, really good points. I think we definitely need to have someone that knows about like small business loans and financial to really come on, because I think when I look at the three of us, right now, I operate with no employees per se, but Doc, you have employees, Marty, you have employees. And so that small business loan, that protection that was supposed to cover, and to know you had to go through all of those hoops. So it is true that a lot of us are saying we shouldn't open, but then you also have those business owners that are saying, if I don't open, my kids don't eat. And so I would much rather do this than my kids not eat, me not have a roof over my head. So let me go out and let me do this. And it's unfortunate that that's a decision that so many people have to make. And I think to just come back to this, because we've been talking about how coronavirus has hit Black and brown communities. And we did talk about eating. We talked about all that stuff, and we do understand that. I think one of the things that we definitely have to talk about too is the fact that because a lot of our Black and brown communities are barbers, hairstylists, nail salons and stuff like that, where they're touching the public, where they may not have been able to get that money, that small business loan. And so now you're seeing those communities hit hard. But I wonder, and I mean, we can't speculate, but just thinking what will happen when we see these things opening, and will it still be Black and brown communities, these vulnerable communities that are hit the hardest because really they had to go into work. So
you bring up a very important things there. And me as a small business owner, we did not qualify, or we missed round one of this. So we had other businesses, I guess, that superseded us. And so we're on the holding tank, if you will, or the waiting list if round two comes about. So I'm looking at, I have therapists and parenting coaches that I'm going, okay, I'm one payroll away from not being able to pay them should some other things not come in with that as well. And so I agree with you. There needs to be a different type of criteria in which we do disperse these fundings to a lot of our minority and Black and brown owned businesses. But that was only because I have an amazing financial accountant who does all of my monthly bookings and billings and P&L statements and all of that, my wheelhouse. But I needed to make sure that I had someone who stays on top of that, because I wouldn't know the first thing about it. And I believe that a lot of us in our communities don't know the first thing about how to go about doing that.
Right. Absolutely.
And it definitely puts us at a disadvantage not knowing about how to do that. And especially if you work, you get paid in cash, primarily. I mean, you may get some credit cards, but it's extremely difficult for doing this process of trying to get money, because you're supposed to be able to apply even as an independent contractor. You should be able to do that, or the nonprofit. However, it's not that easy. And I can tell you this: once they opened up in early April, after 1 week, literally, the money was dried up like that. Then they released some additional monies this past week, and next thing you know, okay, you figure, well, you're on the bandwagon now, you should be paying something, and still nothing. But I believe that the banks who are adjudicating these loans, they have their clients that they prefer to give the money. So these people, there's a preference there, and so the little guy not getting anything.
Right. And so then and then you see this cycle, right, of should we open, should we not, do we have to go in? And Marty, I do want to ask you this, because we were talking, and I was reading on the Gallup poll, and I want to talk about this just really quickly, is that they asked a group of Americans around April 6th through like the 12th. And one of the questions was, how long can you follow social distancing practices, business and school closures before experiencing significant financial hardship? And one of those answers, the highest among, financial hardship, or before their emotional and mental health suffers, the biggest group was that 18 to 44-year-old group. I mean, they were the highest percentage. In April, 26% were already saying, oh, I'm already there. And that was for mental health and all that stuff. And then significantly, it was at 22% for that same group before they experienced hardship. And so I think as we're navigating COVID with all the medical stuff, I mean, even the mental thing. So like, what is something that, someone can do that unfortunately actually has to do this? They have to go to work, right? I mean, what are some ways that they can just navigate that mentally, being scared to go to work, but have to go to work?
Right. I think, and when we're seeing, especially a lot of those who are the front line, let's
Hmm.
be honest, a lot of times those it, are in the grocery stores, are the barbers and all of that who are panicking and all that. The one who's cleaning and all in the hospitals, the clerks, the CNAs, the LVNs that have to do all of these things. And I was talking about a good colleague of mine is pinning this as he's calling this the corona cognitive crisis, because now we're dealing with a whole lot of cognition. We're dealing with all of these things. And I stated last week how this is a complicated anxiety, because we're dealing with this, something we've never dealt with before, and we don't know how. But definitely, I think it's definitely having those conversations, putting together your own safety plan, and
Mm,
everything that Doc has been telling us about that, and making sure that we are eating as healthy as possible. We're getting rest, that we're having even these conversations with our employer and asking the employer, what are you doing to ensure that I am safe here?
that's
And,
right.
in that, I do that with my own therapist. I'm checking in with my therapist, it not just collectively, but individually once a week, because I need to make sure that check their temperature gauge as well, making sure they're doing the right things. And Doc, I love what you said. I do some work at a group home as well. Lord, I think I'm Jamaican, 10 jobs. And what we
Join the
do,
club.
we have to, as I log in into the group home, we take our temperature, and log in our temperature when we arrive and log our temperature when we leave. And we have to make sure that we also kind of give a verbal testimony, if you will, for lack of a better phrase, that we have not been exposed or that type of thing, as we're trying to do everything we can to keep the safety of those residents and other staff members, and protecting our own families.
Absolutely.
Absolutely.
Absolutely. And Doc, I want to ask too, we're talking about just how do they stay safe? And I think that's one of the things where you kind of come in
Mhm.
is how can they stay safe? I have to go in, but how can I stay safe? What are some of those precautionary measures? We talk about it again, but I'm going to drill it in some of the vitamins, some of the stuff that they can do to try to protect
Mhm.
themselves, even though they do have to go out.
Mm-hmm.
Well, yeah, definitely you have to build up your immunity, and you have to stay away from stress, because stress will
Yes.
knock your immunity down. But I just want to talk about, let's say if you have to go to work, you know, one of the things we're doing as healthcare professionals to keep ourselves safe, I can tell you that. But in Georgia, the cases are not going down yet. You
Ah,
haven't reached peak yet, right? So you're still increasing. So it's really 3 to 4 weeks premature for them to be open. But say now, okay, you're a barber and you work in a shop, and now you have to take the precautions. First, the Department of Health here in Georgia, they will give you a test if if you're having symptoms. Once again, you go back to the symptoms. If you're a healthcare worker, you as well. You have to go and you need a nasal swab, and they will mail it, and then you'll get the answer. But it's so important to know: do you have it? Yes or no? I'm a barber. Do I have the antibodies, or do I have the active viral RNA? Me, because if you know, most sensible people are not going to go around other people, right? So
right.
testing is crucial. If you don't have it, then you want to protect yourself. You want to wear masks and you want to wear gloves. That's the first primary thing. As a barber, you should be wearing a gown, right? So that's also another thing. You should make sure you wash those things every day. Well, in our office, if we have anyone with respiratory infection, we'll put on a face shield. It's a little plastic shield that actually covers that underneath our mask, plus gloves, right? And a gown. So
Yeah.
these are things that you can do to protect yourself. You have the right PPE. The people who you're coming in contact with are not sick. Ideally, you would like to know their status. Like if you're dating, you
Right.
say, are you HIV positive or
Right.
negative?
Right.
Yes.
COVID positive, COVID negative. It'd be nice to know that, right? So if you know that, then you're going to respond appropriately. But I think any of these shops that are open, they should invest in a good thermometer and make sure no one is coming into their shop that is actively infected or asymptomatic and shedding.
Right.
But Doc said a really important thing, Portia, that was really good, because it shows, and I love this integration of medical health and your mental health, because they are so tied together.
Absolutely.
We have to start practicing more integrative approaches to our health.
Yes.
Because we cannot separate the two. And he talked about when our stress and anxiety is high, our immune systems then are much lower, and how we have to protect all of that. And I tell people all day, get grounded, do what you have to do to maintain your mental your mental cognition,
Right.
and make sure that you are mentally healthy, that you're getting the necessary rest and all that, getting the vitamin D that you need, and getting the sunshine, getting all those things, lowering your anxiety as best you can. Again, it's about controlling those things you can and letting go of those things you can't. And in that, you're going to find yourself being a lot more mentally sharp. Therefore, you have now the ability to fight off those germs or what have you, because now you're being more proactive about it, if I can say that.
Absolutely.
Right.
I love that, Marty. You know, one of the things that I do, and obviously I'm not a frontline worker, and I'm just thinking that those that are, when you have a break, when you have a moment, you know, there's certain apps like Headspace, Encounter. I use the Encounter, Abide, Calm. All of these apps, you can literally do it for free. They have like 3 minutes. And so most of us are not conditioned for 30 minutes anyway. So 3 minutes of just that Encounter app, just that mindfulness, you know, as you're going out and having to do this, but take that time away for yourself. As Doc and Marty has said, that as stress goes up, your immune system goes down. And so the way to combat this, you know, when you are out there, is to make sure that we're building up our immune system. And so, Doc, one of the things I wanted to talk about was, because there's so much talk about antibodies and who has this antibody. And one of the questions I want to ask is, one, are there different strands of this? And then two, could I have an antibody for, say, COVID? I'm just making this up, guys, but could I have, you know, an antibody for, say, COVID-19A, but still get infected or infect someone with like COVID-19B or something like that? You know, like how the flu is, sometime you have a different strand of the flu.
Yeah, well, I'm glad you said A or B, because there is, first of all, remember the first case, that the first time we did this COVID update, I talked about the coronavirus, you know, because the coronavirus is not new. Okay, when people say coronavirus now, it's all of a sudden that you think it's the whole species that's new. It's not. The new virus is the COVID-19. That's the new virus. But you have 7 strains of coronavirus, right? You have alpha, gamma, omega, and then you have MERS, and that was a big thing a few years back. You have SARS, that was a big thing, and now you have COVID-19. The last 3 are the ones that can cause death, right? Bad respiratory infections, and it can kill you. However, the first 4 were just the common cold virus, and we've been dealing with those on a regular basis. What they believe happened is that this COVID-19 has been around, right? We call it COVID-19. It's been around, or co-SR. It's just that it mutated from an animal and got into a human. So now it becomes a human novel virus.
Got it.
Okay, so it's new, but it's new to humans. It probably was around in animals for a while. So this COVID-19 is obviously it binds to the lung tissue, and it creates a cytokine storm and inflammatory cascade in the lung that causes the lungs to fail. And you can call it a pneumonia, but it's really just fluid and that builds up in there. It's a viral pneumonia, and people die because they suffocate because they can't get the oxygenation in. So older people who are stressed, and who are those? African Americans have a much higher rate, and brown people have a much higher rate of contracting the disease for three main reasons. I want you to understand that. Number one, we have more stress. As a people, we have more stress. We're more liable to have, to be poor. So we have more financial stress. We may have different family stressors that are there. That's the first thing. We're just more stressed. The second one is that we have our socioeconomic status is not as high, so we don't have the fallback. We're also number one on the front lines. We're the ones who are driving the buses. We're the ones who are the grocery clerks. We're the ones who are the transit workers. So we are more exposed. We don't have the we're just going to stay home. We have to get up at 5, 6 in the morning and still to go and drive the bus and to do everything that we do working in grocery stores. So it's going to be much higher. And then the last thing is that we have more comorbidities. We have a higher health issues, from heart disease to diabetes to obesity to asthma. All of that combines is the reason why you see so many of us are dying from this condition, because we're getting it more, because we're exposed more. We don't have the resources. So it's a combination of all of those things that makes it much higher in the African American and Spanish populations.
Absolutely. I completely get that. And so one, you answered the question, is that Georgia's numbers are not declining. And so, I think knowing that and understanding that information, people can make a informed decision, not just the people who have to go on the front line, because I think we all kind of understand some of them have to. And that's just, it's a sad reality, but it's a reality. But people, for the rest of us that want to go, and I guess it's hard because you want to support small businesses, but you want to be careful. And so, Doc, about the testing, like, where are we in Georgia? Have we started this massive testing? So at least if we're going to open up, then like, hey, everybody come get tested, so that we know that these people, who has it, who doesn't, who's asymptomatic.
They still don't have the mass testing available to everyone who is asymptomatic. If you are symptomatic, if you have symptoms, the health department, you can go online and complete a questionnaire. I actually had forwarded you the questionnaire that earlier on today. You complete that questionnaire, and you'll get a second email from them telling them, yes, you qualify, you can go and get tested. So you can either go to a LabCorp facility or a Quest facility, or go to the health department and get tested. That's a nasal test. They'll mail it to the lab. Well, actually, the health department have their own lab. So they would do that, a centralized lab here in Atlanta. They would do it, and then you would find out that way. But there's no mass testing, as you would think, drive-through testing. They had some that they were setting up with CVS, but I'm not even sure exactly how that's rolling out. But it's certainly not enough testing to be opening up the state. Because all you're doing now is making more people frontline workers. Essentially, that's what you're doing. You're telling now the barbers and everybody that you're now a frontline worker, yet still some of them may not have masks. They may not have gloves. They may not know their status. So there's so many things that are going on. And anyone who wants to go back to work really need to take heed and get checked first, know your status first. Then make sure you have the proper personal protection so that you don't get it.
Absolutely. I love that, Doc.
I was saying, I was reading somewhere, Doc, that they were talking about, because of this, since Friday and yesterday, that there has been an increase of cases that have happened in specifically Atlanta. Now, I
Mhm.
can't recall, and forgive me, I did not can't list the source right now, but they were saying there were some 30 or 40 new deaths and another 300 new cases.
Yeah. Well, yeah, I mean, see, it hasn't gone down yet. It's still on an
Right.
incline, so you can't really say that. But what they're expecting to see is within 2 weeks, now that it's open, within 2 weeks, you'll see an increase, a rise. You'll see another blip. So say you're going up, then you'll see another, like a sharper blip
Right.
within the next 2 weeks because of the opening.
Yeah.
I guess
Yeah.
my fear is also that what they're talking about that in Las Vegas too, how the mayor of Las Vegas wants to open up the casinos. And I heard I'm staying away. I'm just 3 hours away. I'm staying away for about a couple of
Absolutely.
years.
Absolutely. I think, Marty, as we're talking about people going back into the world, as a Army vet, having been to Iraq and served there, one of the things that I'm very cognizant about is people going back to work and even us going out. And I think equipping us of going out of our bubbles into
Mhm.
this world that is scary.
Mhm.
So as people are most likely the frontline workers that had not been out, right? So like they're opening their shops or, a restaurant is opening now. How do we manage going back into the world? Because I think we're ready, they want to go back, they want to make the money, but what happens when that kind of that anxiety or something comes up where it's like, wait a minute, I'm actually really, really scared. And so how do we manage that even as we start to go into, opening up when it's safe?
Right. Portia, I think that's a great question. I think we need a plan. I think you need to do an individual plan for yourselves. Like Doc said, knowing your status is so important. And I love that COVID positive and COVID negative. Know your own ability and what you can and cannot handle. If you are already, he talked about this comorbidity rate. If you already have high blood pressure, if you already have diabetes, all those things, we have to take all of those things into consideration before reintroducing and getting back involved in society. And we're the only ones who can determine that, but we have to be wise in our decision and wise. Yes, I'm anxious and I want to get out, but I want to be wise as well. In doing that, I took my mother out for an exercise just yesterday, and we only went in the car because she was getting angry. My mother's been in the house for about 6 weeks now. So I said, and she had no idea of the changes because it's hard to imagine it if you haven't been in it. So I got in my car, said, I want you to see. We're not getting to see what's happening. And saw the line at Costco and the line at Lowe's, and she was like, "This is scary. Take me back in. I'm good. I'll be good for another 8 weeks." With that. but because of that, but we have to make better decisions, y'all. And we have to really think about, is my going out unnecessarily risk the possibility of losing my life? Because it really is a life or death situation. And we have to manage those anxieties that we do have and finding new ways of again, continuing this connection, because we can connect. Yes, social distancing is killing all of us. I'm an extrovert, so it's killing me. I'm just going, okay.
Hello.
So how can I rechannel all this energy that I do have? And how can I redirect it in a way that's still feeding me as an extrovert, but also keeping me safe in this pandemic?
Yeah, absolutely. Doc, you wanted to say something?
Yeah. Well, I think I agree completely what Marty just said, because it should be individualized. Okay. Now, if you are 70 or 60 or 50 and you have diabetes and your diabetes is not controlled and you have high cholesterol and heart disease and you're overweight, there's no reason for you to be out there. Right. It's basically you're walking around with a loaded grenade and you don't really need it. Right? Even if you have a mask on, you just need to hibernate until it's safe, until the amount of new cases have gone down to a low number. Now, I say that because on the other hand, if you're younger if you're in good shape, you have no comorbidities, you exercise, you know how to manage your stress, because that's how I manage mine. I meditate, I read my Bible, I do my devotions, but I exercise pretty much 5 and 6 days a week because I find out that that's what lowers my blood pressure, lowers my blood sugar, and keeps me healthy. It keeps me vital.
Mhm.
So if you're not doing that, if you don't know exactly what's going to do that, then you shouldn't be out there. But if you're in good shape
Hmm.
and you're younger and you're at a lower risk, very low risk, this is all about risk,
Yeah.
stratifying that risk. If you're at high risk, you shouldn't be there. If you're at lower risk, you can take a chance, but still wear your personal protective equipment.
Right.
Mhm.
That's what it's,
Yeah.
you know.
Absolutely. I love that. So, Doc, where are we in terms of a vaccine? Are we still looking at 18 to 24 months? That's the question. A lot of people,
Mhm,
I mean, you hear a lot on social media, and I think some of the
mhm.
funny is truth, right? Is coming from a true
Yeah.
place. And people are like, I'll see you when they have a vaccine. And just where are we now with that?
Yeah. So first of all, typically a vaccine takes years to develop. Okay.
Yeah.
So they're estimating, between 12 and 18 months is the last thing that I've read about. And that would be remarkable within that period of time. Now, let me explain how you understand how to look at this. Now, the reason why the way viruses work, they have these little spokes, right? And then they attack you, they attack the cell, they
Yeah.
inject their RNA material in you, and then what happens is that they'll mutate. The mutation means it changes it. So that's why, for instance, you have two different strains, an L and an S of the COVID-19. The
Hmm.
S is a little bit more virulent, it's a little bit more powerful, and it causes more disease than the L. But so you do have two strains, but they're very similar, right?
Got it.
So when a virus is changing its DNA or its RNA, it's going to have the vaccine is going to be different. So with the flu, it changes every year because the flu virus changes every year. So you have to come up with a different vaccine. It's not the same flu shot you got last year, you're getting this year.
Hmm.
So with COVID-19, you have two different isomers of them. That one has been mutated, and the Chinese are the ones who discovered this last month that there is two different um, type of COVID-19. And so you have to when they develop this vaccine, they have to make sure that they're covering those two strains,
Got
that
it.
L and that S. So it takes time, and I think 12 months to 18 months is short when it comes to this. But first of all, one big thing, all the other cold viruses that I'm telling you about, the coronaviruses, the
Mhm.
alpha, omega, so on and so forth, there's no vaccine for them. And there wasn't a need for it because we know that you're going to get it and then you're going to kick the habit in 10 days, right?
Okay.
But these are more virulent and they can cause death.
Absolutely. So we have a question, Doc. I want to answer that. Rebecca says, so does the vaccine make the disease less contagious and less deadly?
Oh, definitely. Because once you've been vaccinated, the body has made an antibody to that virulent part of the virus. So as soon as that virus is introduced into the body, the immune system can then eradicate it effectively without you getting very, very sick. Now, some people have really super immune systems, so as soon as it comes in, it can get rid of it, and you don't even know you've had it. And then other people, the immune response will be somewhat delayed, so they will be symptomatic, but then the disease won't be as deadly as it would in others. For sure, a vaccine definitely helps.
Got it. And so we have another question too. Valerie says the CDC took high blood pressure off the list. Doc, can you speak to that? I'm not sure. Val, maybe you can give a little more clarity. I don't know if you know what she's talking about, Doc? Okay.
Yeah, yeah. I think, when they said high blood pressure, they really mean heart disease. Okay. And so, what is heart disease? Heart disease is when you have blockages,
Mhm.
arteriosclerotic disease, where you have blockages, or if you've had a stroke, it's going to be in your brain or your carotid artery. If you've had a heart attack, it's going to be in your heart, your coronary arteries. If you have your leg veins, it's going to be called your peripheral vascular disease or kidney disease. So it's the hardening of the arteries. That is what gives you organ dysfunction, and that's what makes you at risk. High blood pressure is just a risk factor for having heart disease. So it's a risk factor, right? And so is diabetes. They're both like that. So they may have taken high blood pressure off, but it's what is the high blood pressure causing?
Got it.
Yeah.
Got it. I love that. Yeah. I
love.
Thank you for explaining the vaccine. Yeah. You know, it's just like the flu. You know, my kids get the flu back. Everybody gets the flu vaccine, and my kids got it. You know, but they didn't get it as bad as they could have. You know, so we have another question: is the virus airborne? Like, can you get it without touching your eyes, mouth, or nose?
Yes, you can. Remember, this was something we discussed about 2 or 3 weeks back.
Yeah.
What they found is that the viral particle, if someone sneezes, that it can actually stay airborne for up to 3 hours. And that was this big scare because people are like, oh my God, I can't believe that. What is this? The virus has wings? You know, I remember somebody actually went as far as to say that. But apparently it can float for a while. It can float for a while. I don't know about wings, but it can float for a while. But the most common way, most common way of getting it is through touching a surface that the viral particle has landed on, and you touching your nose, your mouth, your eyes, and then introducing the virus into your body that way. But yes, there is a risk. That's why wearing a mask prevents you from breathing that, and the mask basically should trap the viral particles so you're not ingesting it into your lungs. Absolutely.
That's so good. Marty, I just had a question out of nowhere, but are you wearing masks? Oh, no, because you're seeing your patients telemedicine, right?
I'm doing telemedicine, yes.
Excellent.
Yes.
So
but even when I go to my group home, but I will put on a mask with them.
Excellent. Excellent. I think that's one thing to know too, that a lot of therapists are doing telemedicine. If you're feeling like you need help, get some help. And so, Marty, one of the questions I want to say is because you're saying that this is a very complex, right? We're seeing complex anxiety and depression. Yeah. And so from people who never have experienced like anxiety, you know, we feel sad. We all feel sad. But what are some of those feelings that I may be feeling to say, this may not be normal? Like maybe some of those feelings of anxiety that I don't know are anxiety, or, you know, long periods of feeling sad kind of.
Right. Some of those things, you know, the sense of being overwhelmed and it's not going away. You kind of go to bed overwhelmed, you're waking up overwhelmed. This is an overwhelming situation, and the feelings of lack of control. That's where a lot of anxiety comes from. When you feel as if you lost hope, you've lost control, there's nothing you can do about it. You're seeing changes in your sleeping patterns. Maybe you're sleeping too much. Maybe you're not sleeping enough. You're waking up at crazy and odd hours, 3, 4 in the morning, and can't go back to sleep, and not going back to sleep till 1 and 2 the following morning. Maybe you're eating too much, not eating enough, excessive worry. All these things can be definitely signs. Maybe even fidgety. Not feeling motivated in those type of things. What about bad dreams? Yes, you can have some bad dreams because that is your subconscious processing a lot of things that happen too that can come out. Having a series of bad dreams, and then you're remembering them, because most of the time we don't remember what we dream about, but you're having some candid, and you're remembering details about a dream. You're like, yeah, I dreamt something, but I don't know what it is. But you're remembering this. With that can definitely add to it. And Doc said some definitely things. Your stress level is going out. So how do we ground ourselves in that? And I think that is so important. With what Doc is doing is wonderful. And I encourage everyone, meditate. Find some yoga. There's so many free things are being offered right now on YouTube, Instagram, all these other social media venues. Find those things that help ground you. And it might even be a combination of things that's going to work. The thing that might work one day may not work the next. So having a series or a list, even make your list, maybe your COVID 20, your COVID 10 things that you do to kind of reduce that anxiety. It could be journaling. It could be reading a book. It could be definitely exercising, meditating, stretching, working out, calling a friend, writing a love note, writing a thank you note, writing a note to someone. Finding those things is going to help reduce that anxiety, so that, again, I'm going to go what Doc says, so your immune system can definitely go up. Maybe maybe even something as simple as,
Marty, yeah. So Marty, let me ask you a question. Really, in terms of what is your strategy of helping people to be more positive? Because I think that there are certain people who they see the glass half empty, and then others see it half full. How do you make that flip so that, because those are the people who worry all the time, and you want them not to worry. What do you tell them to get them to make a change like that?
I'm glad you said that. One is about changing the way we think, getting rid of that stinking thinking, my favorite saying in that, and creating new neurological pathways of how we think and believe. I sound deep, and I'm not deep at all. I take a couple key words and take what it is. But it really is about that. Self-talk is so good. Telling yourself, I am okay. I am fine.
I am okay.
Yes, with that.
I am enough.
I am.
Yes.
I am enough. And with that, so I'm doing this thing of 30 days of mental motivation. And I'm actually now, since we're on day 26, I believe, yes. Oh, wow. That I'm having people who've been with me from day one going, oh my God, it's clicking. I'm feeling this now. 21 days to break a habit. And I'm saying more like 30 to 40 days. There's something about 40 that's biblical. So I'm,
yes,
in
absolutely.
that. And as you say those things and remind yourself, and even weighing out, I'm a lister, weighing out those reasons why, a gratitude journal.
Yes.
And I love that you said, what are we grateful for? Writing 3 things that you're grateful for every day. And then going back and reading it so that it puts you in the right frame of mind. So now we're shifting the focus of focusing on those things that you're grateful for, or the positive, and eradicating the negative.
Yes, I love that, Marty. Thank you so much. And yes, Marty does do Mental Health Matters with Marty. He's doing a 30 days on his page. So you can follow him. He will be live at 10 p.m. Eastern time, but it's 7 p.m. Pacific. And so you guys have just had some great things. I know we have about 8 minutes left. Somebody had a question, Doc, and I'm not sure if so are all the states mandating masks, or why aren't some states mandating masks? Is it the lower population of, viruses, or?
Well, I know in California, obviously in New York, the places where you have a lot of cases, they're definitely mandating it, but there are areas of the country that have very, very low incidence. And so they're not mandating masks in some of those areas. But definitely in the inner cities, they are mandating masks. And they're, obviously, in Atlanta, they're mandating the masks as well. So even though they're opening up the city, people still have to somewhat keep their social distance and wear their personal protective equipment.
Right. Excellent. So Magaline said, I love Dr. Caroline Leaf, but she says it takes 3 cycles of 21 days to change your mind. Love Caroline Leaf. She really does talk about that negative talk and how to create, those negative trees, those dead trees, and how to create those new trees. So love it. Magaline also asked, how do we get his information? Magaline, we usually do it at the end, but I'm going to tell you because I think it's so special. So you can find him at Martinez Sellers on Facebook, or Mental Health Matters.
Mental Health Matters with Marty. That's the better one.
Oh.
That's my website. And thank you.
Or Mental Health Matters with Marty. And so you guys on May 23rd, you'll be able to hear him every single week because he's doing a podcast. So we'll just keep you guys updated with that. And Doc, how are things going with the patients that you're seeing in your clinic? And like, how are you navigating some of that with the patients that you're seeing and just keeping yourself safe as well as your staff?
Well, I can tell you that 90% of the people that we see in the office are not sick. They don't exhibit any type of upper respiratory or respiratory symptoms. If they do, they're calling the office, and we are doing what you call, we're triaging them curbside.
Okay.
We can do their tests in their car, where we go out with our fully clothed, fully hazmat equipment. We go out there, we do the swabs, and then we'll call them comfort medicines, things to help them with their symptoms. And then, within 48 hours, they have the test. So we have not had a problem with getting tests, whether it be the RNA test that tests for the viral particles, or in our office, we have the rapid antibody tests. So because right now we don't know if it's going to be reimbursed, we do charge a price for that. But many people come in because they want to know, am I immune? The antibody test is going to tell you if you're immune, or if you've just been recently exposed within 3 days of the virus. So, people, there's no excuses for people not being tested because there's no mass tests, because I think everyone needs to know where they stand. And then in another 2-3 weeks, you should get tested again, because if you're out there and you're a frontline worker, you may not be exposed now, but a week, two down the road, you may become exposed. So it's something that retesting is also something that's going to be important.
Absolutely. Absolutely. Somebody else had another question. I want to make sure we get to it. Why do some places have more cases than others? Is it a density issue of people? And so that's probably a lot where we saw in California and New York, and is
definitely. And I grew up in New York City. I grew up in the Bronx, and then, worked as a high schooler in Manhattan. I was a messenger. So, I mean, that is one of the most condensed cities you ever want to be at. So, everybody's right on top of each other. The sidewalk is wall-to-wall people walking down Fifth Avenue, Sixth Avenue, Seventh Avenue. It doesn't matter. It's just jam-packed. So because of that density, that is the main reason why you see so many cases that are in New York, and so many people that have died from it.
Right. Absolutely. How much does the antibody test cost, Doc?
The antibody test is $60.
Okay.
Perfect. And it's a 30-minute test. 30-minute test, whether you have the antibodies or not.
Okay. And this test, I know last week we talked about it a little bit. You said that CVS is that right? Like there's some CVS that are doing that test?
I think there's only one in Atlanta. They have some in some other counties, but there's only one in Atlanta. And all they have to do is go online. Most of these places, you have to fill out a survey, because they do not want to test you unless you have symptoms. But if you're a certain worker, if you're a healthcare worker, they will do it. If you're a frontline worker, you can justify them giving you the test. And those tests are supposed to be free and paid by the government, just like the test that's done by the health department.
Okay, perfect. And the antibody test, is that the one where you get swabbed, or is that like blood? How do they?
That's blood.
Okay.
That's blood, because we want to see, is your body making the antibody? Okay, so when you do a swab test, you're just checking to see, is the viral particle itself, is it in your nose? Is it in the posterior pharynx? So that's what you're testing for with the swab test. Do you have the viral particle? But then the antibody test is your body producing an immunological response to fight it?
Absolutely. So thank you, Doc. I appreciate you guys. We have like 51 seconds left. So what I want to do is I want to make sure. Oh, Doc, you know what? I do have one more question. We were like 3 minutes anyway.
51.
Yeah. So quick question. If say for instance, somebody comes in and they're testing or they don't feel good, like, is it too late to get that vitamin C? Or, do you kind of need to get it before? You talked about the intravenous vitamin C. Is it too late once you have it? Or,
No, actually, last week we had a couple that came back positive, and immediately once we got the positive on them, they came in and, they were quarantined in a room, and we gave them intravenous vitamin C. And after they only got one dose, and literally within 48 hours, they were better. So I'm not going to say this is a cure, so don't mark that down. But I will tell you that they got tremendously better. Symptoms went away, and I thought they were going to come back because I told them you need to do this, at least get 3 doses IV for the week. But after one dose, they were feeling so good they didn't come back.
Oh wow, that's excellent.
Mm-hmm.
So Rebecca,
these are 25, 50 milligrams, of vitamin C that we're giving. And I have several patients who've come in prophylactically because they don't want to have it because they do have comorbidities, but they have the expendable income to pay for it as well.
Right.
So.
Absolutely. So Rebecca said, wait, so if we don't have the virus, you can get the antibody test. I think there are certain criteria, like you said, Doc, right? Like you have to have symptoms. If you're a frontline worker, kind of those are the criteria for the antibody tests, correct?
Yeah, well, you see, that's a weighted question. If she may, you don't know if you have the virus, right? You may be asymptomatic and have the virus. So, if the viral test is negative, then you don't have the virus. But you don't know if you were exposed and the body produced a immunological response. So now you have the antibody to it because you were asymptomatic. You didn't know you had it. Mm-hmm. But if you've been treated for it, if you know you have it, you do need an antibody test later on to make sure that you're now immune to it. Because that IgG that's built up will last, they're thinking right now, for at least 6 months to 2 years.
Okay,
that antibody production. Shucks.
All right. So you guys, thank you again for just, no, I'm going to answer this because she had the question, should you get tested if you don't have symptoms? No, correct?
No. I think it depends on what you're planning on doing. If you plan on staying home until everything dies out, then don't. But if you plan on going and mingling, you need to know your status.
Right. That's our new slogan. You need to know your status. If you're going to go out and mingle and be with other people, you need to know your status. You guys, I appreciate this. Again, what an amazing show. Thank you so much for always coming on. So Marty, before we go, yes. We have people wanting to know, where can we find you? I guess there's a lot of Mental Health Matters, but you are Mental Health Matters with Marty.
Marty, yes, with Marty. You can find it there. Mental Health Matters with Marty, or even on our Marcel Consulting and MHS. And then on Instagram, I think I'm Mental Health Marty, something like that. I should know my handle by now, but we're working on that.
Absolutely. So I did post it in the comments, so somebody can copy and paste it. I think it says Marcel MHS, but you can also find him at Martinez Sellers, just how his name is, and he should come up. So Marty, thank you so much for joining us. Thank you for giving us all that great mental health information and also the tools so that we can manage this even a little bit more.
Yes.
So we appreciate you, Doc. How can we find you? Thank you so much. I always say thank you so much for all that you do for this great information. I think today was an incredible panel and just wealth of information from both of you. And Doc, how can we keep in touch with you?
Well, yeah, you could either go on just Google N1 Regenerative Center. Mm-hmm. And there's a phone number right there. We have 2 locations, one in Hateville by the airport and one in Tucker. So, if you want to test, call up and just make sure if you have symptoms, let us know. We'll know how to treat you. We'll keep you outside. And if you don't have symptoms, then you're welcome to come in and we'll test you as well. But yeah.
Excellent. Thank you so much.
Yeah.
Jackie said, great show as always. Thank you for educating the people. Jackie, we love you. We got to have you back on the show. Maybe next week you'll sit in with the show. So you guys, thank you so much for watching. We will be here next Sunday at 7 p.m. Eastern time. And so we want to thank you just for another great show. As always, you can continue to ask your questions. You can put them either in these comments. You can always PM me or send us a message. You can always send us a message at hello@portiascott.com. We answered that email. And so if you have your questions in there, we'll add it to the show. Also, if you want to stay informed with what we're doing on the weekly show as well as the daily show, you can text the phrase wake up to 31996. That's wake up to 31996. We'll send you some information. We'll send you inspiration and empowerment just so that you have the tools that you need. So as always, we end every single show with this declaration. Waking up is automatic. Showing up is intentional. Today, I will show up. See you guys next Sunday.